Our last session in our 7-week Indonesia in Focus academic seminar series. My name is Beck Strading. I am the Director of La Trobe Asia at La Trobe University. And I would like to start this event by acknowledging the elders of the Wurundjeri people of the Kulin Nation, who are the traditional custodians of the land upon which La Trobe University sits, and pay my respect to their people, both past and present, and extend that respect to other Indigenous Australians and First Nations people who are present at this webinar today. So welcome to this session on patient safety and quality of care in Indonesian hospitals. It's a really great honour to welcome our presenter today, Dr. Inge Dhamanti, who is an adjunct senior lecturer in the School of Psychology and Public Health here at La Trobe University. So before we begin with our discussion, we will have some time for audience questions at the end of the session. So please feel free to put your questions in the Q&A box as we go through the discussion. But I believe we have some slides today, which Diana will be able to get up for us. But I might hand over the virtual microphone over to Inge. So take it away.
Okay, good afternoon, everyone. Beck, thank you so much for the kind introduction. So good afternoon, everyone. And this is in Indonesia. It's currently 11 a.m. So my name is Inge Dhamanti. I'm a lecturer in Department of Health Policy and Administration in Universitas Airlangga, Surabaya. So in this very special event, I would like to share some of my project related to the patient safety and quality of care in Indonesian hospitals. So thank you so much for the La Trobe Asia for inviting me to present this afternoon. So in this presentation, I will present like two big project, and I have a long slide. But hopefully I could present all of this within the given timeline. So we're going to start with the overview of the health system first, and then we'll continue to discuss about the incident reporting in Indonesian hospital, and then we discuss about the quality of care. Next slide, please. Okay. As the overview of the health system, we know that Indonesia, I understand that many of you are aware that Indonesia is a very big country, and we are the we have more than 2,070 million population. So we have so many challenges with our archipelago condition, and also we have so many population. We have so many islands, and it will give so many challenges on the provision of the health system. So, for example, currently, last year, based on the data last year, Indonesia has more than 3,000 hospitals, and we also have like more than 10,000 puskesmas or public health center that is spread over 34 provinces or more than 500 districts. So especially in the rural area where there's a minimum infrastructure or vital infrastructure like basic clean water, also like a 24-hour access to electricity. Many puskesmas or public health center in Indonesia just did not have this facility, and also the access to the public health center itself, the vital road is not available everywhere. So it gives more problem to Indonesia. How could we strengthen our health system, not only for the hospital, but also the puskesmas or public health center. So each healthcare facility, especially hospital, must be accredited and must implement some patient safety program. So we have so many different patient safety program, and which some of them will be discussed here, which is incident reporting and also the national quality indicator monitoring. So because we don't have like a published incident report or published adverse event or patient safety incident, so usually the accreditation status of the hospital is used as the indication of hospital quality. So many people think that if they choose the hospital with a higher or the highest level of accreditation, they will get better care, and the vice versa. Next slide, please. Okay, so this is the quick introduction of the organization of the health system in Indonesia. So since the health reform in 1999, so all the hospitals in Indonesia are under the Ministry of Home Affairs. And like, for example, if there are some hospital in the province, so they will be under the provincial government, and also the district hospital will be under the district government. I'm sorry, is my voice clear? Clear enough? Back? Hello?
Yep. Yep. Sounds good.
Okay. Okay, then. Thank you. Okay. So, while the private hospital has a different line of authority, so this makes the management of the hospital itself, the management of the hospital and how the hospital could be monitored or evaluated is become complex, because it's not easily like, for example, in one region, so the district government will understand all the problem of the hospital in the region, but it's not happen like that in Indonesia. Next slide. So how about patient safety? Yeah, if you say that, so what is patient safety? The patient safety actually is, patient safety is a discipline that emerged with the evolving complexity in the healthcare system. And the aim of the patient safety is to prevent and reduce risks, error, and harm that occurs to patients during the provision of healthcare. So WHO defined patient safety as the prevention of error and adverse effect to patient during while they're receiving the health services. So of course, none of us want to come to healthcare and getting the adverse even instead of getting better. Therefore, we need to implement the patient safety through several programs to reduce the unnecessary harm associated with healthcare. So this actually, the patient safety movement started in 1999, and since that time, it's like all the health services around the world are implement the patient safety program. So next slide, please. And if we talk about the patient safety incident, so there are some categories, as we can see in the next slide. These are the categories of the incident that is widely used in many different settings, but I will not explain this one by one. So for example, if you want to interested further, so there are so many publications are available regarding the categories and the type of incident, and also like an example of the incident in the different healthcare setting. So if we go to the next slide. Yeah, we will gonna start talk about the incident reporting and the hospital. So this is a example of my publication related to the incident reporting in Indonesia. And if we look at the definition on the next page, next slide, I mean. Next slide, please. Okay, thank you. So the back one slide, please. Slide 12. 12. This, yeah, 12. One more slide. Okay, yeah, thank you. So if we look at the system itself, so what is incident reporting? So incident reporting is one of the tools that used to improve patient safety that has been widely used in health facilities in different countries. So WHO have published the reporting guideline. So additionally, in each country, they also issue some guideline, and also in each hospital, they usually have some internal guideline as well. So the purpose of the system is to collect, analyze, and disseminate the lesson from the incident, so the similar incident will not happen again. So the lesson that they got from the incident should be disseminated to the larger community, whether at the hospital or the national level. The reporting happened at the two different levels. The internal level is happening at the hospital, and the second level is happening from the hospital to the national committee. So the system itself in Indonesia is established since 2005. However, even though reporting has become a part of patient safety standard that should be implemented by all accredited hospitals, there are still some issue with the number of the incident reporting that has been quite low. So if we look at the period, during that period, the government has made like a number of effort and modification. For example, from changing the manual reporting to electronic reporting, and also revising guideline, also establishing national committee to manage and analyze incident reporting. However, the number of incident reported has been low in compared to the number of the hospital that we have is around 2,800 accredited hospital in Indonesia. So if we go to the next slide. Okay, this is the ideal condition of the incident reporting. So if there's any incident such as patient fall, wrong side surgery, medication error, near miss, or any other incident in the hospital, so this could go into the detection, and after they handle the case or the incident immediately. So they also need to do the reporting, and after the reporting is collected, there should be analysis. So for example, all incident will be analyzed, for example, every month or maybe every 3 months. So from there, they could understand, for example, like the pattern of the incident. So what incident that happened the most, in what hour is, for example, if they look at the trend of the patient fall, for example, or most of them happen during the night shift, for example, like that. So they could learn something. And from there, they also could identify the contributing factor of the incident. What could be the factor that contribute to the incident? And by doing that, they could understand what are the learning and how they could improve the system. So this is the ideal condition. And then one of the most important things is also that the hospital the hospital or the reporting agency have to provide feedback on the learning. So they provide feedback to the reporter or whether it is individual, the work unit, or hospital. So next slide, please. Okay, if we look at the latest guideline on the hospital patient safety implementation, the third edition one, we could map the organization involved in patient safety in Indonesia. There are 4 organizations, which is Ministry of Health, Hospital Accreditation Commission, Hospital Patient Safety, the National Committee, and also hospital itself. So if we compare this guideline with the previous guideline mentioned there are some roles owned by the district or the provincial health office. But in the latest guideline, there's the role of the district of provincial health office is not described at all. So using this current framework, I think I see there's some weakness because based on my previous research when I did the interview, when I interviewed the staff from the district or provincial health office, they have a very limited knowledge about the implementation of the patient safety in their region, and also they also including like for example, what is the most common patient safety problem that happen in the hospital in their area. So this is one of the weakness because if, for example, the district or provincial health office have or understand the issue, they could assist in monitoring and also in evaluate the performance of the hospital in regards to patient safety. Next slide. Okay, if we look further, so this is the internal incident reporting that happen at the hospital level. So all hospital in Indonesia will have the same procedure because this is what mentioned in the guidelines. So it starts within the department. When the incident happens, staff have to handle immediately, and also the case have to be reported to the direct supervisor within two times 24 hours. And then they start do the analysis, like do the risk assessment, and then make the categorization whether it needs a simple investigation or need the root cause analysis in here. And the learning should be also happen at the hospital level. So the hospital have to provide learning for the reporter, for the work unit, or to the across unit because is important, and then they have to provide feedback. And also the final report is given to the director, and after this this will go to the external reporting to the national committee. So the problem in here, many hospital staff say that we could see this in the in one of my publication in one of the slides. So feedback has become a major concern because many people say that, oh yeah, they reported, but there's nothing happened. They did not get any feedback. Therefore, they don't know what to improve. Next slide, please. Okay. And this one is the external reporting. So all hospital in Indonesia, actually all accredited hospital in Indonesia have the obligation to report the incident to the national committee. But the fact right now, the number of incidents reported has been very low, and the patient safety agency here need to have the capacity to do the analysis and also disseminate the learning. So form of the publication or the learning that common in other countries, for example, like the annual report, and then provide some alert and also some publication. So this is the common thing that common to be found in other countries. And also all of this need to be provided back to hospital, either hospital that reported or the hospital that did not report any incident, and also to the wider community. And the problem here is until now, this was be a mistake, but after I check until now, we don't have any published annual report. Therefore, we don't know the number of incidents that happen in Indonesian hospitals. So this is very different with other country where the annual report of the incident is very easy to download, very easy to read, and also we can do so many alert and so many learning that provided in the website. Next slide. So if we look back at this scheme, so the reporting mechanism for the incident reporting is directly from the hospital to the national committee. And based on my observation, the national committee did not have like a specific website until like they just established new website maybe in the last 2 years, but still all other information are not available on the open space. I mean, in the open platform. So once again, if we look here, so district or provincial health office are still outside the system. They don't know exactly what happened in the hospital, what incident are reporting the most, and what are the contributing factor, and etc. Next slide, please. So this is the current condition in Indonesia because we just have a new reporting system. So it looks like the Ministry of Health take over the incident reporting from the National Committee. So they have established a new system, and the new system is just started from 2020. So this data is the unpublished data. I obtained this data because one of my project is related with the incident. So I need to write a formal letter, and it took like 2 or 3 months to get this data. And if we look at the number of the incident here, it is very low compared to the fact that we have like more than 2,800 accredited hospital in Indonesia. So it seems like underreported. And also the number has not changed much based on my observation according to my doctoral study. So the number is not changed much. Unfortunately, we could not get the data about how many hospitals reported because the National Committee did not provide any information about the hospital, but they only give the information about the incident. So if we compare with Malaysia that just have moved to electronic reporting in 2017, we could see like there's a big difference in the number of incidents reported. So in one of my publications that where I compare the system between the Malaysian, Taiwan, and also the Indonesian system, and I used the WHO guideline to make a comparison, and I could see that Indonesia has many weaknesses in the established system. For example, like we don't provide any feedback, and also there's no like any reward or maybe a clear sanction to the hospital who is accredited but did not report any incident. And also there's a different perspective among many stakeholders at different level of the government. And also like there's a different perception about the barrier in reporting incident between the national agency and the district government, and also among the hospital. So we have so many problems that need to be fixed, but in the last 2 or 3 years, I see some improvement on the system and also on the website that is still being developed. So hopefully in the next few months, we could see that the published annual report like this, which will be really useful for our hospital. Next slide, please. Okay. If we look further, so what causing the low reporting rate in Indonesia? If we look at the barrier of the reporting, so this is based on the study that mixed method study that I did. So in here, I conducted some survey to the health workers from 3 public hospitals in Indonesia, and after I got the finding from the survey, and then I do some follow-up interview, but the follow-up interview is only for the managerial or supervisor level at the hospital. So within this study, I try to identify what are the practical barriers to reporting and also the cultural barrier to report. So for the cultural barrier, I use the Japanese value by Kunchoro Ningrat. This is one of the classical books which say that Japanese have some value that different with other ethnic in Indonesia, and because the 3 public hospitals are located in East Java, so I use the framework to try to identify what were the cultural barrier according to the Japanese value. So next slide, please. Okay, from the survey got like a quite good response rate. I think it's around more than 70%. So we divide the participant into non-reporting and reporting group. So because we want to see is there any difference in the practical barrier or the cultural barrier among the people who report the incident or people who see the incident but they choose not to report it. And we conducted the chi-square analysis. And in this table, we could see that something that the variable that related with the practical barrier is the participants say that they did not know how to report the incident and also lack of feedback. While within the cultural barriers, the significant item is they did not want to have a conflict or they want to avoiding conflict. So this is a very Japanese culture, because for example, if you ever live in Java, you will understand how Japanese people behave. We will not say, we will prefer not say our disagreement. We just want to be quiet and avoiding any conflict. So this is a very typical Indonesian. And this is become one of the factors that significant as a barrier in reporting incidents, because sometimes, for example, if they see other staff make a mistake or other incident happen to the patients, but it involves one of their friends, one of their colleagues, or one of their seniors, so they will not. They will choose not to report because they don't want that the friend or the partner or the colleagues will be angry, and that will cause a conflict. Next slide. Okay, for the qualitative finding, I only put some here, and we could see that the knowledge also become one of the emerging thing here. So the staff did not know which cases must be reported, lack of knowledge, the need for training, also lack of socialization, and also this one is related to the culture. So they feel reluctant to report friend and afraid to be blamed, and also yes, I think this is similar. So next slide, please. So how about the quality of care? So I have like 13 minutes to discuss about this. So this is actually interesting. So Indonesian hospital have the obligation not only to report the incident, but also they need to report their quality of care indicator. So this is also the part of accreditation, and they report this to the CARS, Komisi Akreditasi Rumah Sakit, so accreditation agency. And the project title of the study is the impact of COVID pandemic on quality indicator in Indonesian hospital. So in this study, I wanted to compare the compliance in reporting quality of care indicator before and during the pandemic. I know that the COVID-19 pandemic has caused so many disruption, especially in the healthcare or health services. And I want to know just whether they still reporting the quality indicator. So all the accredited hospital have to report, like for example, in here we have 13 indicators every month. And if we go to the next slide, okay, so each indicator has a standard, and the standard this one have to be met by each hospital. So for example, the A hospital have to report from hand hygiene until the patient satisfaction every month and for the whole year. So in this study, we look at whether the hospital reporting for the whole year and also whether they achieve the targeted standard. Next slide, please. Okay. So if we look back at the organization that involved in the patient safety according to the national guideline, we see here the reporting of the quality indicator is just conducted by hospital directly to the National Accreditation Commission. So once again, district or provincial health office have a very little knowledge about the quality of indicator. So once again, in my opinion, this could be a weakness because because each year actually the district and provincial health office develop some program, which the program could be chosen or could be prioritized from the indicator that, for example, highest that not the highest has become the priority for all the hospital, for example, in the region or in Indonesia. Next slide. Okay, the research question was there a difference in the achievement of performance and the completeness of reporting national hospital quality indicator before and after pandemic? So we used two methods actually to analyze the data. So we obtain a massive data from the National Accreditation Agency. So we do descriptive analytics and also we do the machine learning. But in this presentation, I will discuss about the descriptive analytics only because I don't have the capacity to discuss about the machine learning one, because the machine learning analysis was conducted by Dr. Ida Nurhaida, my colleagues from Adjunct University. So because we got a massive data, so we need the first thing that we need to do is we do the data cleaning. So in the data cleaning, we aim to filter data that meets the criteria. So we want to see from all hospitals in Indonesia which hospital that reported the 13 national indicator for 2 consecutive years, which is 2019 and 2020. So after we got we filter the hospital that met the inclusion criteria, we do the scoring to look at whether they complete, whether they reporting the indicator complete in each month for the whole year, and whether the target is achieved. So we develop a score. So the score 3 is for the good one, yes, so if all indicator fields are met. And the second one, if only one of the indicator is not met by the hospital, and the score 1 is the lowest. So after that, we compare the data set from 2019 and 2020. Next slide. Okay, so after we compare the data set, no, before we compare the data set, we can see that there was a decline in the number of hospitals that were reporting to the system. The decline is like 58% during the pandemic. So in 2019, there were more than 1,000 hospitals reported, but during 2020 is only like less than half. And also the finding regarding the data quality, yeah, we have a big massive data with poor data quality because there's so many missing fields. And also some of the number is like we don't know the meaning of the number, so then we need to ask the national committee staff first. So what's the meaning of the number, because it's look like a 0 point something like that. So, and also if we look at the completeness, only few hospitals reported all indicators, and also only few hospitals achieved all targets. So, and also we have a lot of outliers. For example, the hospital with the highest accreditation status only reported one indicator. And we have also the different condition. For example, the hospital with basic accreditation status only report they reported the complete indicator. So this could reduce the accuracy of the data. So the finding is quite shocking that finally we only find 4 hospitals that reported 13 indicators consecutively in 2019 and 2020. Next slide. So this is the profile of the hospital. So 2 of them are general hospital and 1 specialist hospital, and they have a different ownership and they have a different classification. So not all, at first we assume that the hospital with the higher classification, or maybe the higher or the highest accreditation level, will report better than the other hospital with lower status. But in here, we can find that the fact is very different. We have here the hospital that with the basic, I'm sorry, this is a mistake here. So this the lowest Perdana is like the first time accredited, and this is the basic one, and the excellent is the highest one. So we have a different kind of the accreditation level, and also we have a different hospital location. Well, if we look at the statistic, most of the hospitals are located in Java, and most of the hospitals with the highest accreditation status are also in Java. Next slide. So the few next slide is a bit boring because it's full of the table. So we look at the indicators, and this is the clinical area indicator. And then we look at the trend of the reporting between the 4 hospitals, and we could categorize. There is some indicator the reporting trend is steady, but in some other is increasing or decreasing. Next slide. So the one that decreases, for example, the emergency response time. So if we look at the COVID condition, yeah, maybe we could see that during COVID, most of the emergency department are used to handle a COVID patient. So I don't know whether this will affecting why they are decreased, especially in the level 2 score. So the completeness, either the completeness or the achievement on the target is met. So only one of the indicators met. And also some other decrease in the outpatient waiting time and also specialist visit time compliance. Next slide. So, but the interesting thing is here, we could see that the indicator related to patient safety, we could see that this is some increase, especially in the good score, but none of them have, none of the indicator are in the score 3. So we could say that it is, I don't know, maybe it is very difficult for hospital to to achieve all the targeted standard for hospital. I don't know whether it's hard or I don't know what's the problem, because based on our analysis, none of them are in the score 3. So the increase of reporting trend is in the patient identification compliance, hand hygiene, and also, so hand hygiene, we could see here improve from the score 2, most often previously in the score 1, but then during the pandemic, they moved to score 2, and then adherence regarding the patient risk of failing precaution. Next slide. So some issue that we could conclude here, there is some problem with the compliance in reporting, whether it's in incident or national quality indicator reporting. And also with the current scheme, both of reporting did not involve the provincial district or district health office. And also lack of feedback are reported in the two kind of reporting, because in the what we call it, in the quality monitoring as well, the hospital say that they did not receive any feedback from the national agency. So yeah, it comes to the next one. So feedback from the reporting agency is crucial, and there are also some infrastructure issue, for example, slow connection with the application, glitch, and new and enhanced system. So they keep improve the system. It's mean that, or they move to another platform, which means that the hospital need to adapt again and start again and something like that. And no public reports available, and also I'm pretty sure there are so many missing opportunities to improve safety and quality in hospital. Next slide. So recommendation, I'm not sure about writing this recommendation, because we already have so many policies, so many guidelines, and so many procedures, that we are weak in the monitoring and auditing system, because it's not because the evaluation of the system is not written clearly in the guidelines, and strong collaboration is needed, not only involving the provincial or district health office, that could be involved the university, for example, and the government also needs to improve transparency, feedback, and communication. I think that's all. Thank you so much, and yeah, back to you.
Thank you so much, Inge. That was really interesting. Please do put any questions in the Q&A, because I think we've got 10 or 15 minutes to address any other issues that you might want Inge to talk to. But I do see there was a comment in the chat about the use of foreign doctors in Indonesia and a suggestion that, maybe the system needs an overhaul. So just on that question, how open is the current health minister to opening up the sector to the best foreign doctors? It seems like that's probably not an issue that's really going to deal with the sorts of issues that you're raising around reporting, but I wonder whether you have a response to that.
It's a very long one. Okay, yeah. I think so. We have like as what I know is, we don't, until now, we don't allow the foreign doctor to have a practice here because I don't know what is the reason. It's very political. So I don't have the capacity to answer all of this.
No worries. Well, I wanted to
Yeah.
ask you a little bit more about the recommendations that you offered in the last slide. So how optimistic are you in seeing the sorts of changes that are required to improve the reporting standards?
Okay, thank you. So I think in this 2 years, so I see like some changes, and also we at the international level we work with the ISQA. Maybe have you heard about ISQA? So I think that's a very good progress because it could like improve the transparency, improve the compliance, and improve the guideline as well. But it just maybe just needs some time sometimes. And also I see that there's some people that joining the national team, and I see that this will give like more refresh or update on the current condition. So I think that's a good news.
So I also wanted to pick up, you mentioned the pandemic and you've got those sort of comparisons between 2019 and 2020. I wonder whether you can give us a sort of a more general picture of the sorts of strain that the dealing with the COVID-19 pandemic put on the Indonesian public health system more generally. I think it's a sort of, if we think about the sort of other countries, what the pandemic did was expose these real big gaps or issues within public health sectors. So I wonder whether you could expand a little bit on the way that the pandemic affected, the public health system in Indonesia, but also was it worse in some areas than others, particularly geographical areas, but also maybe specific areas of public health? I know that's a big question, but if you could sort of comment on the influence of the pandemic.
Okay, thank you. So I have one project related to the COVID-19 and patient safety, which is the manuscript is under review. So maybe I could use that an example for a bit. So yes, the COVID-19 has affected not only Indonesia but many countries, and also Indonesia has become more struggle because we need a longer time to adjust on the pandemic condition, as we could see maybe in the news that many of our workers have to use the raincoat. They have to use like a triple cloth mask because of the medical mask was really expensive, and also we have the scarcity on the oxygen and everything. So yes, we are struggling a lot, and also we don't have like a good referral system compared to Australia. So for example, if a patient coming to the emergency department and they need to be referred to other hospital because lack of facility. So the thing that happened is because the hospital is very busy, and maybe they have a very limited ambulance. So the family have to call other hospital to find whether they have a room or they could accept another patient, and also maybe some of the family also have to get the ambulance by themselves, or maybe they could just use the public transport. So maybe you ever read during the Delta variants, in the July, we had so many people, so many patients that die while waiting to get examined in the emergency department. So this put more burden on the patient safety because delaying in providing care is one of the patient safety areas. And also, for example, the patient actually need higher care, so they need to go to the ICU, but the ICU was full, and that's why they have to be care in the emergency department with the lack of facility. And for example, they don't have a ventilator. So this has happened in Surabaya, for example. But if you look at the other geographical area where the hospital maybe is not the hospital with the higher accreditation status, or maybe not the higher, not has the low class classification. So maybe they only have like a one ventilator, or maybe they have a very limited ICU. So many people will have, many patients will have what is the problem in accessing care, just only to get care at the hospital. So many of them being turned away and die during during finding the hospital, or maybe they die at their own home. So that's the example. So yeah. So if I may continue, so how it's related with the patient safety. So according to my project, so we could say that the most incident that happened during the pandemic is delay of care. So because the health workers say that, oh yeah, this patient is especially definitely need this care, but it's not available, so they just die. That's the most common incident that happened. And also the second one is if because during the pandemic, the government opened so many field hospitals. So the field hospital is first, they're not, of course, they are not accredited because they just open like very quickly. And based on the interview, some incident that happened because they don't have like a specific procedure, and the health workers who work in the field hospital are coming from many places from Indonesia. They sent by the government, and they don't have like a similar skill. They don't have standardized training, so that will affecting on how they provide care to the patient as well. And the incident that happened the most is, for example, related to the administrative. For example, patient move to another bed because they feel hot in this side, and they just move without give notice to the health worker. So what happened next is when they want to do the test, or they want to provide the medicine, so the patient is already moved to other care, and this is a dangerous. For example, if the health worker did not conducted like patient identification properly, because they could just to give the injection to the wrong patient, they could just give medication to the wrong patient. So I think that's an example. So that's happened in Surabaya. I don't know, maybe in Papua, it will be totally different story because limited resources. Thank you.
Yeah. Well, that's really interesting. And there is a comment here in the chat, which is from somebody who works in the public hospital at a district level. And during the pandemic, they did try to measure the quality through the KARS indicators, but the main reason that they couldn't collect the data and report it is because the accreditation survey during the pandemic was postponed, and lots of units in hospital were struggling with the pandemic, which is, kind of what the point that you've just been talking about there. But there is another another question here about your experience, not just in Indonesia, but in other countries. How much does incident reporting improve quality? I guess quality might be in terms of quality of care. And how does the pandemic increasing in Indonesia actually raise awareness in terms of the need to improve quality, or to make steps to sort of address some of these issues in the public health system?
Yeah, thank you, Beck. So thank you for the comment from Milo Sapti. And I will go to answer the other one. So how much incident reporting improves safety and quality? So based on the theory, yes, if the incident conducted properly, so it will improve the quality, because based on the incident reporting, we could identify the area of weakness within the hospital system, and based on that, we could do the quality improvement project. That's based on the theory. How about the reality? If we look at what implemented, for example, in Australia or in the UK, that has a really good incident reporting system. So if they catch many incidents, that is better, because they have a more source, they could identify more problem, and they will give more opportunity for government to put some money on the area where there need the improvement. So what I learned from New South Wales, from Clinical Excellence Commissioning, for example, they look at which incident that have been reported the most, and which area that need improvement. So, for example, in this year, we will focus on this area. So they're gonna make something, the program that will be implemented or will used to intervene the system for the whole hospital. So that is a really good approach, but that's not happened in Indonesia, because we don't know which incident that happened the most, or which incident that is become the priority, that should be become the national priority, because there's no transparency in the incident. And the second one, how pandemic increasing Indonesia awareness in this is a very difficult. Yeah, because how do I say answer this one? I think it's difficult, because not many people are aware on the quality improvement. Yeah. So yeah, maybe some area, yes, because of the pandemic, but I think not only because the pandemic, because they already work in the system, the health system, even before the pandemic, it is very easy for them to identify the problem. And every time there's a problem, we need to do something to fix the problem using the quality improvement. I think maybe that's I could answer that.
Well, thank you. We have actually just run out of time. So thank you so much, Inge, for sharing your research with us. It's very important work that you're doing, and we're very grateful that you spent the time to walk us through your research. And thank you also to our audience members for tuning in and for putting in questions and comments throughout the presentation today. Please follow us on Twitter at Trobe Asia, or join our mailing list to find more details for online events and publications that we have coming out. So thanks again, Inge.
Okay, thanks.